To have with us Angeli Achrekar, the Deputy Executive Director of the Joint UN Program on HIV/AIDS. As you know, next week will be World AIDS Day, and in advance of that, there's a report for World AIDS Day entitled "Take the Rights Path." It's great to have you.
Terrific. Thank you so much, Farhan, and it's a real pleasure to be with you all again. As just noted, World AIDS Day is coming on the 1st of December, which is this Sunday. And as we approach World AIDS Day, we always take a moment to remember the over 42 million lives that have been lost to AIDS. We also take a moment to recommit to our shared goal of ending AIDS as a public health threat by 2030. Today, we are launching our report, Take the Rights Path to End AIDS, which brings a message of hope, unrelenting hope, but also a call of urgent action. Ending AIDS is not only about health, it's also about our commitment to human rights that underpins the very access people have to health. At its core, the fight against AIDS is about people, it's about dignity, it's about equality, and it's about justice for all. We can end AIDS if the rights path for people living with and affected by HIV and AIDS are protected. Together, because of the power of partnership and shared global solidarity, we've made extraordinary progress in the global HIV response. More than 30 million people living with HIV are alive today and thriving because they are on life-saving treatment. AIDS deaths have plummeted by 70% since their peak. This is really extraordinary progress over the past few decades. And while there is significant progress, this does not mean that there is success. Major gaps in people served, especially with HIV prevention and protecting rights, remains a challenge. And so we must make sure that we continue to succeed on the path of ending AIDS as a public health threat by addressing the rights that people face. Key and vulnerable populations continue to be at risk. Adolescent girls and young women, key populations, children, for example, these are the populations that are hardest to reach and hardest to find. Today, 1.3 million people around the world acquire HIV and AIDS. This is 3 times higher than the 2025 target that the globe is set to achieve. That's 4,000 new HIV infections among adolescent girls and young women just in a week. In 28 countries, the number of new HIV infections is on the rise, and of the nearly 40 million people living with HIV, 9.3 million people are still in need of treatment. And last year, 630,000 people died of AIDS-related deaths. This is 1 every single minute, so about 45 deaths occurred in just the last 45 minutes we've been together. To bring down the trajectory of the pandemic, it's imperative that life-saving HIV prevention and treatment services can be reached without fear by all who need them. When people in need of services are confronted with stigma and discrimination, when girls are denied education, when there is gender-based violence, and when people can be arrested for who they are or who they love, the result is that people in need of HIV prevention and treatment services are blocked from care. Public health suffers, and the goal that we have to end AIDS as a public health threat is at risk. Laws, policies, and practices that punish, discriminate against, or stigmatize people obstruct them from HIV prevention and treatment services. So do to the policies and practices that block health workers or peer counselors from doing HIV outreach. But we can right these wrongs. Leaders must do 3 things. First, remove discriminatory laws that violate rights of people living with and affected by HIV. Second, resource community-led responses to protect rights so HIV services can be accessed. And third, root the HIV response in human rights approaches to enable access to HIV services. The AIDS response is at a crossroads. We can end AIDS if we take the rights path and walk this together. And finally, by upholding human rights and tackling discrimination, we can end AIDS and save millions of lives and ensure a healthier future for all. Thank you.
Thanks very much. I'll now turn the floor over for questions. First question goes to Pam.
Yes, I'm standing in for UN Correspondents Association. I'd like to thank you on behalf of UN Correspondents Association for the briefing. I'm Pamela Falk, U.S. News and World Report. My question is, your Deputy Director, Christine Stegling, said about this report that the lack of human rights is what's putting a stumbling block to making even more progress that UNAIDS has made over the years, and that there will be more people with HIV by 2030 if that's not corrected. How can that be corrected?
Thank you so much, Pamela, for that question. That's exactly right, and that's exactly the essence of this report, that human rights is, in fact, a barrier to prevention and treatment services. The very reason that we still have 1.3 million new infections every single year, that's stalled. We haven't progressed in that way, is because we're not addressing the human rights barriers that enable access to prevention and treatment services. What we have to do is really make sure that countries are focusing on these 10-10-10 targets that we have in our current global AIDS strategy. That is that less than 10% of countries have discriminatory laws that enable access to people living with HIV to services, that less than 10% of people living with HIV experience stigma and discrimination, and that less than 10% of girls in key populations experience gender inequality and violence. If countries, together with communities, work together to really address these human rights barriers, only then will we be able to work to address the prevention of new infections and ensuring that those that have not been reached for treatment are in fact reached.
Thank you. Thanks. Yvonne?
Thank you very much for this briefing. Yvonne Moriarty, News. I have a question about funding. How dependent are you on donations from the United States, whether that's via WHO or other routes, and are you concerned about changes in funding when the new administration takes office? Thanks.
Thank you very much for that question, Yvonne. The HIV response is indeed dependent on countries and communities around the world funding this response. What has transpired over the years has been something, nothing short, I should say, of extraordinary, where countries of the world have indeed come together to not just show political commitment to the global HIV response, but also put funding toward the HIV response. In fact, nearly 60% of all funds that come into the HIV response are from countries themselves that are actually funding their response. The U.S. government over the past 30 years has been an extraordinary partner and leader in the global HIV response, primarily through their bilateral program, the U.S. President's Emergency Plan for AIDS Relief, as well as their contribution to the Global Fund to fight AIDS, TB, and malaria, and their leadership and support of UNAIDS, the joint program. The U.S. government and changes that will happen in the U.S. government, what we have seen in the past is that whether Democrat or whether Republican administrations have taken ground, the HIV response has always enjoyed bipartisan support. During the first Trump administration, there was great support for the global HIV response. We hope that the U.S. government, as well as all countries of the world, continue to support the HIV response, because we are not yet there. We are not yet at that goal of ending AIDS as a public health threat, and it will require continued support, continued leadership, continued financial and political commitment from all countries of the world, including the U.S. government.
Thank you, Farhan. My name is Alejandro Rincon, and I'm with NTN24. We're an international news service from Latin America, and our follow-up question concentrates on this region in particular. I wonder if you could share with us maybe some details or an overview on how Latin America overall as a region is doing in the overall fight to try to mitigate new infections. Maybe you mentioned on the report that there are still 28 countries where all of these trends of maybe new infections are growing. Is Latin America one of those regions, an area of concern or not? So how is this region overall doing in the fight against HIV?
Thank you, Alejandro. The Latin American and Caribbean region, as I noted earlier, new infections are rising around the globe, and they're shifting. There's been great progress on the African continent with treatment acceleration and also new infections decreasing. But what we're seeing, as you know, the 28 countries that are on the rise with new infections, is that we're seeing other regions of the world that are in need of prevention services and closing the treatment gaps. Latin America and the Caribbean, while they have made considerable progress in the HIV response, new infections are indeed rising there, particularly among key populations, men who have sex with men, LGBTQI plus populations, for example. And a big part of that is related to the human rights barriers that we were discussing earlier, stigma and discrimination that is still very pervasive in many of these countries. So while there has been a significant amount of progress in the African continent, Latin America and the Caribbean, the Asian Pacific, Eastern Europe, these are different regions of the world that are going to need additional support to make sure that we are working collectively to reduce new infections among those populations.
Quick follow-up. The report also, I just got the report a little while ago, but it mentions the biomedical advances. And that seems pretty astounding how much has come through in terms of medicine, treatments. Has that wended its way down? I mean, is part of the problem financing those some experimental, some approved treatments to poor countries, and is there a separate fund for that?
Thank you for that question, Pam, and that's really, really important. The biomedical advances, these innovations that have happened in the HIV response are extraordinary. The interesting thing is that here we are in 2024, and I would say this is almost like the 1996 moment for us, where in 1996 we had antiretroviral treatments, something that was going to save people's lives. Today, now, in this year, we have access to long-acting injectable drugs that can prevent new infections. They are almost 100% effective at reducing new infections. Lenacapavir and other long-acting prevention modalities that now exist are incredible. It is the 1996 moment for prevention. The problem is that these prevention medications, these innovations, are not yet affordable, and they are not yet accessible to all the populations and the subpopulations in countries that need them. So together, UNAIDS, together with countries of the world and private sector, we are really working to make sure that we can drive those costs down so that more and more people who are in need can access those life-saving prevention technologies that now exist. So that is kind of what is in that is the almost amazing, game-changing moment we're in right now, and we have to make sure that we continue to press forward so we can bring these this almost miracle medication out to the populations.
Thank you.
don't see any questions online. So with that, I'd like once more to thank our guests. Thanks very much, Angela.